السلام عليكم أحبائي الطلبة. اليوم المحاضرة هو التي بي. راح تكون تي بي ضمن 3 محاضرات إن شاء الله. التي بي in our society is endemic disease. You see TB many times in our patient, and TB can involve many or any organs. TB is an old disease and it was fatal in the last time, but nowadays because of treatment it can be curable disease. This diagram showing the distribution in the world of the TB, and our country is one of the countries involved in TB in ratio about 25 to 99 per 100,000 population, and the TB can involve any part in the world, but more common in the Africa and in India, mostly in the poor society and more crowded society. The TB, as I said, is old disease, affect a human and caused by bacteria, in form of bacilli. We call it Mycobacterium tuberculosis. Mycobacterium tuberculosis complex, which mostly affect the lung, but can involve any organ by the blood-borne infection in up to 1/3 of the condition. TB, as I said, is a curable disease, can be cured if the patient receives treatment perfectly and for the required time, but if untreated it is fatal within 5 years in 50 to 65% of cases. So it's curable disease and can be treated by the patient by treatment, but require special treatment and special duration. How we can get TB? TB is a droplet infection. I mean blood infection like in COVID-19 nowadays, and by airborne infection. The transmission usually occur through airborne droplet nuclei, which produced by the patient during sneezing or coughing or even speaking. These droplet nuclei, which are small, less than 5 micron. Let's see the difference between the transmission between the droplet and airborne droplet, which mean the nearby distance by during coughing and sneezing, in if the droplet nuclei about 5 micron. If the droplet less than 5 micron, the distance can be more distant of the patient and remain suspended in the air for a few longer times, which can affect other person in the same population. Imagine one person can coughing of this droplet in a crowded area or crowded room, so most of the people can get infection by the airborne droplet infection, which are less than 5 micron. This is comparison with the hair, human hair, about 60 micron, human hair. Imagine the size of the micron of the droplet, very tiny, small droplet, which can get infection to the person. And each cough or each sneezing, the person can produce 3,000 infectious nuclei per each cough. So the main route of transmission is by airborne droplet. The other route of it is rare by the skin or by the placenta, and other bacteria, which is Mycobacterium bovis, which is mainly in the cows, we can get infection by the drinking the infected milk or unsterilized milk from the infected cow. So this is another type of Mycobacterium, but in the involved type in Mycobacterium tuberculosis, which is mainly by the airborne droplet infection. This particle, or this droplet nuclei, when get an entrance to the our respiratory tract, it will be engulfed by the macrophage, and macrophage will present the antigen, which is the droplet to the CD4, the helper cell, which produce more stoichioin, interferon alpha and gamma, which produce or which recruit more cell monocyte. This diagram showing this process when the patient get droplet infection by the bacilli, and here will get infection bacilli, which get to intensity to the macrophage. Macrophage engulf these bacilli and present these bacilli to antigen as foreign antigen to the other helper cell, which helper cell produce more stoichioin to produce or recruit more lymphocytes, and lymphocytes surround these macrophage and dead tissue, forming the granuloma, which is the sign of chronic inflammation. أخذنا الباثولوجي and inflammation يكون chronic in case of TB, so causing granuloma, which is typical histopathological appearance اللي هو caseating granuloma. So the granuloma form inside the lung tissue and with the bacilli inside, which making the later on the cavity or the lung lesion, which can infect, can produce more bacilli to get infection to other person. So the formation of this mass inside the lung, we call it going focus. And when this bacilli reach the lymph node, draining lymph node, we call it going complex. So we have the entrance of the bacilli to the body tissue, and the response coming from the macrophage, the engulf the bacilli, producing more presenting to the helper cell CD4, which produce more stoichioin to recruit more cell to producing the granuloma, about the collection of the monocyte, macrophage, and dead tissue and dead cell to form granuloma, which is caseating granuloma. This granuloma, we call it cone focus. When the bacilli involve the draining lymph node, we call it, our regional lymph node, we call it gone complex. This is the same diagram of histological granuloma. The major feature of the local pulmonary tuberculosis, you see the site mainly in the apical region. Why in the apex? نجيها إن شاء الله بعدين، لأنه bacilli of the TB are aerobic bacilli which need aerated tissue, so mostly infect the apex of the lung, forming this granuloma, or this is the cone complex. When involved the lymph node, we call it cone complex. This is the histopathologically. You see the caseating granuloma, and if this bacilli, after getting transferred to the tissue or to the lung, if the bacilli spread to the lymph node or lymph or blood vessel to cause disseminated bacilli before the immunity is established in the body, so the secondary foci present in the other organ, which is called extrapulmonary, which is present in about 30% of the condition, which can involve the lymph node, the serous membrane, like membrane pleura, peritoneum, pericardium, meninges, and bone, liver, kidney, and lung. You see, any organ can be infected by the TB. These foci resolve once the immune response is activated and the organism gradually loses viability. However, if the patient having less immunity or the bacteria aggressive, very highly virulent bacteria, infection may be persist for many years to get reactivation of the TB later on. Now the infection of the lung occurs firstly, then the spreading of the bacilli to the other tissue by the blood or by lymph to involve the other organ. Now, many organs have been infected by the TB, like brain, like the intestine, like the genital organs, even the fallopian tube, the urinary tract, liver, spleen, and the muscle and bone. All these can be infected by the TB bacilli to get disease. And we see many persons having TB of the intestine, TB of the periton, TB of the bone, TB of the kidney. Many persons and many patients in our society, because of the TB is endemic in our society. This is the gross pathology of patients getting TB of the lung, of the brain, of the liver, of spleen, and even the retina. Now the etiology. What is the etiology of TB? As I said, the causative agent was bacilli. We call it Mycobacterium tuberculosis. These bacilli is non-spore forming, rod-shaped, aerobic bacilli, which about 0.5 to 3 micron, and often once stained, most common staining technique هو يسموه acid fast bacteria. هو زيل nothing staining. The name of acid fast bacilli come from the ability of these bacilli to resist the decolorization by the acid or alcohol. Any bacteria, when we stained by this heat and fusion stain, this is non-acid fast bacilli, this is usual bacteria, and this is TB اللي هي acid fast bacilli. When we stain by the fusin, you get red color. When we attack by acid alcohol or acidic material, which is decolored, you see the non-acid bacilli come decolorized, but the T bacilli is still having the same dye. And then when we give methylene blue, also the patient, the TB, non-10 TB, sorry, having decolored by methyl blue, while the acid bacilli not colored by. Why? Because of the cell wall of the Mycobacterium tuberculosis is different from other cell, having two way to antagonize or this acid material or alcohol material. Why? Because the cell wall of the bacilli having lipid mycolic acid, which antagonize or having low amenability to the cell wall, making the effectiveness of the antibiotic reduced. So require longer duration antibiotics and longer duration of high dose of antibiotic. The other molecule, other point, make the Mycobacterium tuberculosis resistant to the dye, and we call it acid fast bacilli, is the presence of the lipoarabinone, which is the making the involved in the pathogen host interaction and maintain the survival of the bacterial bacilli within the macrophage. So making the bacilli dormant or latent in the macrophage without killing by the macrophage defense mechanism. So that is 2 points: making the bacilli latent and virulent, which is require more duration of a treatment and even more immunity process. Now the TB after the was killer disease in the past, but nowadays, because of the of a new approach of treatment and with the good sanitation, and even in the developed countries, the TB is disappeared in these countries in the last century. But in the end of the last century, the TB get emerge again in these countries because of many factors we covered now. So TB in the developed countries appear again due to many factors. But in the developing countries like our country, the TB is still present and endemic and not disappeared because of many problems. أول شيء poverty, crowdedness, poor compliance to treatment, and poor or low education and poor program to reach to distance area of our country. The reason for the increasing incidence of TB. ليش ال TB incidence increasing in the last years? In developed countries, as I said, in the last century, is the TB is ended or eradicated. Why they again in the TB in these countries? Because of immigration, because of the HIV infection, poverty, of homelessness, increasing the proportion of the elderly. You know, the half-life of the patient or the life of the patient in those countries increasing, and resistance. While in developed countries like our country, while TB is increasing because ineffective program, lack of access of the health care. مو كل المرضى يجون للمستشفيات. Poverty and HIV, population increase and drug resistance. So you see, many factors increase the incidence of TB, but differ from developed to the developing countries. Okay. Now the factor make the patient at risk for TB. These are patient-related factor like age term or age extreme, like children and more geriatric age يكون less immunity وبالتالي يظهر TB. First generation of high prevalence countries, immigration of high prevalence countries, close contact of patient with smear positive TB, overcrowdedness like presence or association, chest X-ray evidence of the self-health TB, and viral infection less than 1 year. All these factors are patient factors which make the patient at risk for TB. Other factors اللي هي social disease, the patient having immunosuppression, like patient having HIV infection, or having immunomodulating agent, or having a steroid, or malignancy, or diabetes mellitus, CKD, silicosis, GI disease make the patient liable for the gastrointestinal TB because of the acidic material is defense mechanism against TB bacilli. But if we have disease in the gastrointestinal tract, we can get GI TB, and deficiency of the A and D also as factor for the infection with TB. So this is the factors make the patient at risk of TB infection. Now, what are the clinical features? The clinical feature of TB depend on the duration or depend on the progression. Here, this diagram, when the patient get bacilli infection in the primary infection here, the patient gets parenchymal complex, as we said, parenchymal Gohan complex, which involve the lung parenchyma and lymph node caseation causing complex. This complex take three way. Either this complex controlled by the immunity of our body, and patient get infection like flu-like illness, fever, cough, and then the immunity of our body interact with this complex, causing healing of this lesion, calcification, and even scar, and cause primary infection and end with healing, cure. And those patients we can diagnose by the changing of the tuberculin test إلى positive يكون هسه نجيها. أو النوع الثاني patient who get infection by the primary infection by the bacteria اللي هو bacilli of the TB, and forming the complex, and then this complex progressive involving the lung, causing more destruction of the lung, and even enter to the bloodstream to causing progressive pulmonary disease TB, which involve the blood metastasis and miliary TB and the progression of the lung with calcification and cavitation. The other way, patient get this complex, but the patient or the bacilli interact with the immunity, causing partial control causing the dormance of this bacilli, making it latent for months or even years. These latent bacilli inside the complex of the lung parenchyma يكون dormant for long duration and protected from the immunity. This get infection, reinfection or reactivation of this latent to cause post-primary. The post-primary هو mostly of the adult type. ليش؟ لأنه يصير after many years of the primary infection. And this is characterized by the cavitation, fibrosis, caseation, miliary TB, and the scar. So, the TB infection, when we get TB infection and enter the lung parenchyma, يا اما يروح يصير به healing by the immunity ويصير healed lesion وأز scar و calcified lymph node، يا اما يصير progression of these complex ويصير progressive disease involve the lung parenchyma and reach the bloodstream to reach the other organ causing progressive pulmonary TB، يا اما controlled partially by the immunity to make the bacilli latent خاملة latent for many years to reget reactivation after many years by many factors. Any person have latent TB and get reduced immunity by the any of the disease we said it, or any immunity reduction by the drugs or by severe illness, so-called post-primary TB اللي هو يصير after many years اللي يسمونه adult type, which characterized by cavitation, fibrosis, and so on. So this is the diagram explain the clinical fate or clinical outcome of the infection with TB bacilli. This is the primary pulmonary TB, which refers to the infection of the previously uninfected healthy person, tuberculin negative individual. A few patients develop self-limiting febrile illness, flu-like illness, and the clinical disease only occur if there is hypersensitive action or progressive disease. And those patients يكون healthy individual, infection يكون subclinical, mild fever, and indicated by the presence of the cell-mediated immunity اللي هو tuberculin skin test. tuberculin skin test نجي إن شاء الله بالdiagnosis هو عبارة عن skin test نسويه على مود نشخص التي بي by the injecting a patient or the person with the purified protein of bacilli. إذا the patient having previous infection, so there is high persistent action against TB bacilli which is causing reaction. يسموه tuberculin skin testing. So those patients with the primary TB يصير febrile illness, mild illness يكون subclinical ووراه يتحول إلى tuberculin test negative positive sorry. أو هنا الليجن قلنا عليه قبل شوية يكون calcified ويصير healing ويصير calcification of the node، هذا كله primary. أو يصير قلنا progressive primary اللي هو يصير عندهم destruction of the lung in the same duration or the same time of the infection by the TB. أو يكون post primary after a latent period of months or weeks or months يكون post primary disease اللي نسميه of adult. Feature of progressive pulmonary or primary tuberculosis infection يكون about 4 to 8 weeks. قلنا قبل شوية يكون as influenza-like illness, skin test conversion to positive, primary complex present in the lung, and the disease and patient or the disease progress to involve the lung causing lymphadenopathy, hilar or collapse, consolidation, emphysema and hemicavitation, pleural effusion, endobronchial involvement, miliary involvement, meningitis and pericarditis. Hypersensitive action causing pneumonitis and arthritis and even conjunctivitis. So this is the progressive primary disease اللي قلنا يصير after the primary infection. So the other type, third type اللي هو post primary اللي هو latent type اللي called adult type لأنه يصير reactivation or secondary infection after many years after the primary infection which is caused a flare-up of the bacilli activity after the immunity reduced, and the infection mostly occur in the apical and posterior segment of the upper lobe where the oxygen tension يكون high لأنه مثل ما قلنا الباسيلاي of the TB هي يكون aerobic وبالتالي تحب الاوكسيد tension فتكون الانفكشن mostly أو lesion mostly in the upper lobe of the lung. Other type of TB هو miliary TB. من قلنا قبل شوية من يصير infection of the lung وبروجرس to involve the lung. Some person get the TB bacilli get entrance to the bloodstream to cause blood-borne dissemination of the bacilli to the whole organ, causing miliary TB. Miliary TB acutely present in the character about 2 to 3 weeks of fever, night sweat, anorexia, weight loss, and dry cough. Liver spleen يكون enlarged and patient يكون headache because of meningeal involvement. Auscultation يكون normal, sometimes we have crackles. Fundoscopy showed choroid tubercle. The classical appearance on the X-ray هو يكون miliary appearance اللي هو جاي من اسم ميلت سيد اللي هي about 1 to 2 millimeter lesion اللي حبوب الدخن يسموها involve the whole lung and sometimes involve the other organ. Anemia and leukopenia are present because of lymph node and because of bone involvement by the T bacilli. This the lesion we see in the X-ray and scan اللي هو millet set اللي هو miliary TB. Unusual presentation of in the elderly اللي هو cryptic miliary TB, which is not involve the lung but involve the organ, which is occur in the over 60 years. يكون intermittent low grade fever, diagnosed as POO, pyrexia of unknown origin, which is one of the cause of POO هو miliary TB اللي هو cryptic type. Unexplained weight loss, يكون patient weak or fatigue, liver spleen in about 52%, normal X-ray لكنه involve other organ يكون blood dyscrasia, leukomotor reaction, pancytopenia. Negative tuberculosis test يكون aggressive type confirmed by the biopsy of tissue. We can see granuloma in the liver or bone marrow biopsy. In case of pulmonary post-primary, the onset is typically insidious لأنه يكون after many weeks or months, develop slowly over several weeks, and patients come with fever, night sweat, malaise, loss of appetite, anorexia, and weight loss. And patient characterized by the chronic cough with hemoptysis, BO, unresolved pneumonia, pleural effusion, and sometimes patient is not diagnosed by X-ray, weight loss, and spontaneous pneumothorax. This is the post-primary TB, which is we call it latent type or call it adult type because occurrence of this type many months or weeks after the primary infection. Chronic complication of pulmonary TB can cause many complications اللي هي pulmonary and non-pulmonary, which sometimes requires surgery in some condition. Now the X-ray. The X-ray is very useful in diagnosis of the TB. The earliest feature of the TB is the cavitary formation, most commonly in the upper lobe, and can involve 1 or 2 lobes, 1 or 2 lungs can be involved. Also, as disease progress, we can get consolidation, collapse, cavitation to 1 degree. The presence, this is very important, the presence of miliary pattern and cavitation indicating active disease, يعني infectious disease. Extensive disease, collapse may be marked and insignificant displacement of the trachea and the sternum. Occasional caseous lymph node can be drained to the joining bronchus, causing tuberculosis pneumonia. This is the X-ray finding can be seen. You see the cavity in the upper lobe of the patient with TB, and this is the CT scan also showing the cavity. This is the patient progression from normal X-ray to cavity lesion and then to advanced fibrosis and the destruction of the lung in the advanced disease. This is the X-ray finding in case of TB-UC involve the upper lobe because the aerobic bacteria like the upper upper lobe. Now the different diagnosis. We have many X-ray findings in your textbook. You see the manifestation of TB, either pneumonia, collapse, either cavitary lesion, either pleural effusion, or miliary involvement. In case of miliary involvement, we have differential TB, number 1, sarcoidosis, malignancy, pneumoconiosis, and fungal infection. While in pleural effusion, which is common in our society, in our society, any person come with effusion and fever is TB until proved otherwise. Differential of this patient, pleural effusion, pneumonia, we call it parapneumonic effusion, pulmonary thromboembolism, carcinoma, and chronic disease. All these are differential diagnoses of pleural effusion in case of TB infection. Cavitary lesion can be seen in the TB, as I said, but also in the pneumonia, lung abscess, cavitary lung cancer, pulmonary infarction, vaginal granuloma, and massive fibrosis. This is differential of cavitation. Or collapse, consolidation or collapse can be seen in TB, or pneumonia, carcinoma, whatever. So this diagram is very important, giving the differential of the lung lesion which present in TB. So miliary can be in this condition. Pleural effusion can be seen in this condition. Cavitary lesion can be seen in this condition. So this differential diagnosis of TB presentation in the lung. Now, the extrapulmonary TB, which is also can be involved by the TB because of the TB is in endemic country, and we complete this topics in the next lecture. Thank you.